Hello and welcome to session 4. In this lecture we're going to be talking all things micronutrients. And it's quite an interesting lecture, session 4, because there's so many elements that we can discuss and talk about when it comes around to micronutrients. Some micronutrients such as B vitamins and vitamin C, they're water soluble, and you can actually become deficient in them in a matter of days or weeks, where you've got other micronutrients such as your fat soluble nutrients, where it will actually take a number of months or even years before you start seeing a deficiency. So let's dive into this and learn more about micronutrients. Let's go. All right, first of all, micronutrients play an essential role in human health. They support with the prevention and treatment of disease, and they're utilized for optimal physical and mental functioning. Now, we only need them in a very small amount in comparison to your macronutrients. Now, just because we need them in a small amount doesn't mean they're not as important as macronutrients. They're just as important, as they have small individual roles that they play throughout the body. Now, having a micronutrient deficiency in early life can actually result in stunted growth in children and actually increase the risk of a number of diseases in adulthood. So broadly speaking, there are two types of micronutrients. You've got vitamins right here, and you've got minerals. And we're going to be discussing some of the major vitamins and some of the major minerals throughout this lecture. It's quite interesting that these micronutrients, they play a fundamental role in a number of nutritional biochemical pathways throughout our body. We're going to touch on a few of those in the later slides. Now, within vitamins, you've got two major subgroups of vitamins. You have your fat-soluble vitamins, and then you have your water-soluble vitamins. Now, your fat-soluble vitamins include vitamin A, vitamin D, E, and K. Now, the beauty of these fat-soluble vitamins is that they can actually accumulate and store within our body, meaning that we don't necessarily need to consume them on a daily basis, because we can actually have a store. We can actually discuss in the next slide how that could actually prevent or actually result in toxic overload of some of these fat-soluble vitamins. Now you've got what we call water-soluble vitamins. That is, they are soluble within water. Now they include your B vitamins and vitamin C, and they can actually be lost quite easily, and they actually need to be replaced on a daily basis, or you may actually become deficient in these water-soluble vitamins. So let's look at some of the characteristics and properties of water-soluble vitamins in comparison to fat-soluble vitamins. So starting off up the top with absorption. Now, the absorption of these water-soluble vitamins can go directly into the bloodstream, whereas fat-soluble vitamins will get absorbed with lipids into the lymphatic system before going into circulation. Looking at the storage, these water-soluble vitamins are generally stored freely within the blood, whereas your fat-soluble vitamins are actually stored in first the liver and also fat deposits throughout the body. Looking at the excretion of water-soluble vitamins, and if you consume an excess amount of these water-soluble vitamins, you actually pass them out in your urine. Whereas fat-soluble vitamins, it's a lot more difficult for the excretion of these fat-soluble vitamins, and they'll actually be stored in your body. Now, looking at the toxic effect of water-soluble vitamins, now it's very rare to have a toxic effect from water-soluble vitamins within your diet, within food. However, if you were to take very high dosage of water-soluble vitamins in a supplement form without the supervision of a nutritionist or a naturopath or your general healthcare practitioner, that may actually result in potential possible side effects. An example of this is vitamin C. Now, vitamin C is a very safe vitamin. However, if you were to consume upwards of 10 grams of vitamin C, which is a water-soluble vitamin, you may have a side effect of diarrhea. Okay, looking at fat-soluble vitamins, because they can't be readily excreted within the body, they are retained in the body and thereby more likely to result in toxic overload if someone was to consume too much of them. The sensitivity of these vitamins. First of all, your water-soluble vitamins are a lot more sensitive to the environment. They're a lot more sensitive to heat and light, whereas your fat-soluble vitamins, they're relatively stable when exposed to heat and light. Looking at the chemistry makeup of these vitamins, water-soluble vitamins, they're quite simple in structure, whereas your fat-solubles are quite complex. Looking at the sources of water-soluble vitamins, generally plant-based items. So vitamin C is only obtained from plants. B vitamins, yes, are found in plants, but can also be found in animal-based products. Whereas fat-soluble vitamins are found both in plants and animals, but mainly in animals as we come to learn. Let's start off with vitamin A. Vitamin A is a fat-soluble vitamin, and it supports with a number of different elements in our health, such as vision, immune function, normal reproduction. Vitamin A can be found in, look at this, animal-based foods. As we just said, that these fat-soluble vitamins are more commonly found in fat-soluble or fatty animal-based foods. You've got things like liver, dairy, egg, and oily fish. Now, for the vegetarians and vegans who are listening, don't be scared. You can get vitamin A from plant-based sources. It's called provitamin A right here. You would know this as beta-carotene. Okay, provitamin A is the chemical structure before vitamin A, before the vitamin A found in animal-based product. So this provitamin A, aka beta-carotene, can be converted into vitamin A within our body. Now, food sources high in provitamin A, you're thinking of green leafy vegetables and orange and yellow vegetables such as carrot and sweet potato. Now, because it's a fat-soluble vitamin, heating and cooking these foods, especially carrots and sweet potatoes, can actually make the vitamin A more bioavailable and thereby an increased absorption and utilization of that provitamin A. Now, deficiency of vitamin A, think of eyes, generally eye-related conditions, one of which is night blindness. Someone has night blindness, it may be a result of vitamin A. Another deficiency is an inability to fight infection. So that's your immune response. Infertility, miscarriages are another indicator of vitamin A deficiency. Delayed growth and delayed bone development could be another potential deficiency sign and symptom of vitamin A deficiency. Now, the risk of deficiency is higher for those with illnesses affecting the gut. So we're thinking of celiac disease, which is an autoimmune disease that affects the small intestines, and let's say inflammatory bowel disease, which includes things like Crohn's disease, ulcerative colitis. When the gut lining is affected, and this will go for all vitamins and minerals, the absorption of these vitamins and minerals will actually be compromised because there's a particular pathogen or let's say disease within the gut. Strict vegans can also pose potential risk of vitamin A deficiency if they are not consuming enough provitamin A foods. individuals who live in poverty, and the consumption of excess amount of alcohol. Vitamin D, oh, very interesting one. We did touch on this a little bit in week 1, so we'll go more in depth to it now. Now, as we alluded to in week 1, vitamin D is actually synthesized within our body. So as this diagram explains, UVB rays will come into contact with our skin, right? And then that will create what we call like a pre or a pro vitamin D. From there, it will go throughout the liver and the kidneys to become what we refer to as active vitamin D, and then it will go and have a function throughout our body. Now, the interesting thing about vitamin D is that it actually acts like a hormone within our body. So although we call it vitamin D, potentially we should be calling it hormone D instead, which would be a more accurate representation of how it acts and works within our body. Now, there's 2 different forms of vitamin D. You've got vitamin D2 and vitamin D3. Now, vitamin D3 is obtained from animal sources and is the most utilized or the most beneficial form of supplementation in regards to vitamin D. Vitamin D2 is found in fungus such as mushrooms. Now, here's an interesting one. If you leave your mushrooms out in the sun, in the midday sun, it can actually increase the amount of vitamin D within the mushrooms. You can also get D2 supplementation of vitamin D here. Now, unfortunately, you can't obtain enough vitamin D in the diet alone. You need to have sunlight to have enough vitamin D in our body. Now, a few things to note. Individuals with dark skin need almost 3 times more sun exposure than those with pale skin. All right. Another thing to note is sunscreen. The application of sunscreen will actually block, which is designed to do, UVB radiation rays, thereby there'll be a lower production of vitamin D in the body. Now, this particular image is quite a useful one. In the grey is the areas that can obtain vitamin D year round. So in summer, we can get higher amounts of vitamin D. In winter, get lower amounts of vitamin D. So let's take our friends down here in Tasmania, right? And also our distant cousins in New Zealand. During the winter months, they can't actually obtain vitamin D. That the UVB rays from the sun doesn't actually get through the atmosphere, and thereby you can't actually make vitamin D during the winter months outside of the grey area. So anything above here, so all this blue, so we're looking all at Europe, Russia, America up here, and Canada, and New Zealand, Tasmania, those particular areas are at risk of vitamin D deficiency. Okay, some of the functions of vitamin D. Now look at this, it supports with calcium homeostasis. Okay, it maintains serum calcium concentration. How it works is we'll explain that in the next slide, there's a nice image, but basically it enhances the ability of the small intestines to absorb calcium. Okay, it also regulates the immune system, right? So if someone has an overactive immune system or an underreactive immune system, so an example of that is an overreactive immune system is things like autoimmune diseases, whereas an underactive immune system is things like cancers, right? Vitamin D supports with the regulation of the immune system to bring the immune system back into balance. It can also, in addition to supporting calcium homeostasis, it enhances the absorption of phosphorus from the diet. Phosphorus. Deficiency in children, and now this is quite rare in Australia, but more common in third world countries, you can develop rickets, and that's a bowing of the legs, right? You can also develop later on in life softening of the bones without enough vitamin D. you can develop osteoporosis, okay, and potentially increasing the risk of autoimmune conditions because there is that immune dysregulation happening. Now, factors increasing demand for vitamin D, the elderly. Why? The elderly have a reduced ability to utilize and obtain vitamin D from the sun because of their skin. There's that lack of conversion. Here we go, lack of sun. Now, we just think right now, as we're doing this, New South Wales has gone into a semi-lockdown, requiring people to stay indoors. Thereby, if we stay indoors more frequently, our ability to obtain vitamin D from the sun reduces, thereby we are at risk of vitamin D deficiency. As I mentioned earlier, dark-skinned individuals will require longer periods of time in the sun to obtain the same amount of vitamin D as those like myself who are quite pale. Living location, so if you're living in New Zealand, the UK, Europe and Americas, or let's say North America, you won't be able to obtain vitamin D year round. Vegans, yes, because we can obtain vitamin D from the diet, small amount, which does contribute to our overall vitamin D status. However, there's very few vegan foods which have levels of vitamin D in them. And also fat malabsorption. So individuals who suffer from particular conditions where you can't absorb fats, that will go for all fat soluble vitamins. There is that reduced absorption. So here we have what we call the vitamin D and calcium homeostasis balance. So let's start off up here. Low blood calcium levels. If we have low blood calcium levels, two things will happen. There will be an increased release of calcium and phosphorus from the bones, which will help to support normal blood calcium levels. And then in addition to this, there will be a greater conversion of vitamin D, right? So if we've got higher amounts of vitamin D, we can actually increase calcium absorption in the small intestines, thereby balancing out what we have here, your normal blood calcium levels. Now, on the other hand, if we have high blood calcium, that is too much calcium in our blood, what we can actually do is store it within our bones to regulate the amount of calcium within our blood. Okay, moving on to vitamin E, another fat-soluble vitamin. Now, vitamin E protects polyunsaturated fatty acids from oxidation. So that is cell damage, and it acts as an antioxidant. Now, this is where you raise your hand and go, Brad, what is an antioxidant? To understand an antioxidant, we must first have an understanding of what a free radical is. So a free radical is an atom, and it has one or more unpaired electrons, right? So what happens is an antioxidant will come along and it will donate one of its electrons to the atom to stable it again. So it will, vitamin E will actually neutralize free radicals and can actually prevent damage to our DNA. Looking at dietary sources of vitamin E, we've got nuts, different variety of nuts and seeds, avocado. We've also got things like your fish, your salmon, your mackerel, and so forth. Now, most dietary sources of polyunsaturated fats also have vitamin E in it. So your polyunsaturated fats are, these nuts and also your fish, and they also have vitamin E. Now, the exception to this is actual fish oil, right? So if there was a fish oil without vitamin E, there'd be an increased risk of it having oxidation or free radicals. So a lot of supplement companies will actually add in vitamin E to a fish oil to protect it, to act as an antioxidant, somewhat as a preservative. Therapeutic uses for vitamin E, as we might have alluded to, it supports with cardiovascular disease. It inhibits platelet aggregation, thereby you've got less likely of clotting. It can also support in skin health. Now, diets rich in vitamin E have actually been linked to a lower cancer risk. Okay, dietary antioxidants such as vitamin E may actually help to delay or prevent cataracts, which is a particular eye condition. Vitamin K, the last of the fat-soluble vitamins. Now, vitamin K, look at these food sources here. Green leafy vegetables. Look at that, fantastic. It's one of its main function is for its clotting factor. So you've got particular medications such as warfarin, which will actually block this function. Thereby, individuals on the medication warfarin really need to monitor how much vitamin K they have, or otherwise it may counteract the effects of the medication. Now, yes, vitamin K, right here, can be obtained from food sources. But the really unique thing is vitamin K can also be synthesized in the large intestines, supplying about 10% of what we need. Now, particular antibiotics can actually reduce intestinal bacteria population and thereby actually reduce the amount of vitamin K the gut is able to produce. So a deficiency state may result in severe bleeding, right? Because there's that inability to support with normal clotting up here. Another thing I'll add in this one is when a baby's born, one of the first things that will actually happen is an injection or even drops in the mouth of vitamin K. Why? Because babies don't have the ability to produce or synthesize vitamin K, and thereby require support with that. So that's a general practice that happens in hospitals, is the use of vitamin K in infants as soon as they're born. Okay, now we're going to move on to your water-soluble vitamins, starting off with B vitamins. Now, there are a lot of B vitamins, B1, B2, B3, all the way to B12. Different B vitamins have different functions within the body. So you've got over here supporting with blood formation, right here. You've got things like B6. Hold on, let's go. B6. Folic acid, that's B9. And then we've also got B12. All of these elements, let's say, B vitamins, will actually support with red blood cell formation. Other B vitamins support with nervous system function and metabolic health. One of the major functions of these B vitamins is to support with energy production. So let's delve in a bit deeper to these B vitamins. So here's another diagram kind of breaking up these B vitamins. So here we've got energy releasing B vitamins, right? These B vitamins support with glucose metabolism. They support with the production of your major energy currency within the body, which is adenosine triphosphate, which is known as ATP. So that's your B1, B2, B3, and so forth. As we alluded to in the previous slide, these B vitamins support with red blood cell production. All right, so let's look at the individual B vitamins. Thiamine, which is your B1, supports or helps with the conversion of glucose into energy and has a role in nerve function. Riboflavin, which is B2, also supports with energy production and helps with skin health and vision as well. Niacin, which is known as B3, helps with the conversion, so slightly different to B1 and B2, but helps with the conversion of carbohydrates, fats, and alcohol into energy. Okay? And also supports with your nervous and digestive system. B5 supports with the metabolism of carbohydrates, protein, and fats, and also alcohol. And it plays a role in the production of red blood cells. Other B vitamins, you've got B6. B6 is an interesting one, and one that is gaining a lot of researchers' attention in recent years. Yes, it supports with protein and carbohydrate metabolism. It also is involved in red blood cell production. One of the interesting ones is it supports with brain chemistry, brain chemicals. So these are your neurotransmitters. These are things like your serotonin, your dopamine, your noradrenaline. These neurotransmitters within our brain require B6 as an element, as a cofactor to actually make. So to make serotonin, serotonin is your happy hormone, you require sufficient amounts of B6 for the conversion. Supports with immune function as well, and here we go, may even support with PMS, so premenstrual syndrome. And premenstrual syndrome, individuals may take supplementation of B6. Unfortunately, you won't actually obtain enough therapeutic levels of B6 in the diet for it to support with PMS. However, some healthcare practitioners are prescribing B6 to support with PMS. We've got B7, needed for energy metabolism, needed for fat synthesis, glycogen synthesis. Now, another interesting element of B7 is if you consume too many raw eggs, it will actually bind onto B7, and you can actually become deficient of that within your diet. Let's look at folate here, B9, needed to form red blood cells. It's required for the development of the nervous system, so it's really important during pregnancy, especially in the first trimester, to prevent what we call neurotube defects. Also supports with DNA synthesis, growth and detoxification, something called methylation. We might talk about that when we talk about B12. B12, there we go. One that deserves its own slide because it's such a unique B vitamin on a number of different levels. First of all, only about 2.4 micrograms of B12 can actually be absorbed at one time. And that's because the absorption of B12 is very difficult. Our body relies on something called intrinsic factor to actually bind onto B12 and support with the absorption. So the amount we can absorb on a daily basis is very low. Now, B12 can actually support with the or maintain myelin sheets, the nerve cells. So our nerve cells throughout our entire body have got this covering, this nerve cell covering around it, and B12 is essential for maintaining that. It supports with red blood cell formation. It supports with methylation. That's a process of detoxification, right? And there's this close relationship between B12 and folate. And generally, you would assess both of them at the same time and look at both of them within the diet because they work hand in hand in a number of different pathways within the body. Now, vegans are at risk of low B12. I'll say this now. Out of all the potential vitamins and minerals that are out there, vegans, the one vitamin or mineral that vegans are most likely to become deficient in or need to monitor is B12. That is because there is no B12 found in plants. Some may say, oh, but spirulina has got B12 in it. It's such a small amount, it's not enough to maintain your stores of vitamin B12. Of note, B12, it almost takes between 3 to 5 years to become deficient in B12. So an individual who goes vegan isn't necessarily going to become B12 deficient in the first month or two. It's 3 years down the track, that's when they'll become B12 deficient. B12 deficiency, generally you could say tingling and numbness within the fingers and toes. That's because the myelin sheaths are compromised because there's not enough B12 within the diet. You may also result in tiredness and fatigue due to the requirement of B12 in the production of red blood cells. Loss of appetite, memory issues can be a result of B12 deficiency. Okay, let's look at some of the food sources where B vitamins can be found. Now, there are a lot here. Have a little look over them. I'll point out some of the major ones to take into account and to consider. Let's look at B12 here. As we mentioned earlier, it's only found in animal-based products. So this is your liver, your meat, your milk, your cheese, your eggs. So animal-derived products is where B12 is found. On the contrary, on the other side, might I say, B9, which is your folate, is mainly found in green leafy vegetables, seeds and nuts and so forth. Yes, you can have some in poultry, eggs and liver, but one of the main sources are your green leafy vegetables. Other elements, you got B1 up here, whole grains and cereals, B3, a number of animal-based products as well. Same with B5, B6, you're looking at more green leafy vegetables, nuts and poultry as well. Okay, let's look at some of the consequences of deficiency of B vitamins. Now, subclinical B vitamin deficiency is common within Australia. That is where you don't have a severe deficiency or an acute deficiency of B vitamins. You just have a low-grade deficiency of B vitamins. And that can generally result in tiredness, fatigue, anemia, loss of appetite, depression because of a lack of these B vitamins, which support in neurochemical, your pathways within your brain. It is more common within older adults, and as we alluded to, vegetarians and vegans. Now, looking at some of the individual B vitamins, a deficiency in B1, in thiamine, can result in what we call beriberi. Now, it's generally not found within general society. However, those countries where the dietary staple is white rice, there is a higher likelihood of deficiency in those areas. B2 deficiency is rare. However, individuals who consume excess amount of alcohol are at risk of B2 deficiency, riboflavin. Other B vitamins, you are really looking at the consumption, or the overconsumption of alcohol can result in deficiency of these B vitamins as well, which is quite concerning. Let's go back, I will mention here neurotube defects. That's probably a very important one to take note of, and that's not enough folate during the first trimester. So B9 is folate. Not enough folate during the first trimester of pregnancy can result in neurotube defects. Vitamin C, right, another potent antioxidant. Vitamin C is only found in plant-based sources, so your citrus fruit, your kiwis, your broccoli, and so forth. Some of its functions, it also acts similar to vitamin E as an antioxidant. So I'll bring your attention to this image down here, right? So this compound right here, this atom, this is an antioxidant, right? So when a free radical is around, it will actually donate an electron to stabilize it again. So that's kind of a visual representation of what an antioxidant does within the body. It supports with immune support, especially something called a cytokine storm. Now, this is quite relevant right here, right now, because the coronavirus, COVID-19, early research is actually suggesting that individuals who contract the coronavirus, some of those can actually have what we call a cytokine storm. Okay, and antioxidants such as vitamin C may potentially support in these individuals. However, further research would need to be conducted before we can say if that's the case or not. Vitamin C also supports with collagen synthesis. It also supports with neurotransmitter synthesis, so the production of dopamine within our brain, which is the hormone required for focus, concentration, movement, and motivation. Now, this could be a major takeaway message right here. I'll highlight this in red for you. Aids in the absorption of iron, in particular your non-heme iron. We'll go into this in more depth when we talk about iron. However, vitamin C supports with the absorption of non-heme iron. Now, non-heme iron is iron derived from plant-based foods. What does a deficiency of vitamin C look like? You would be thinking of things like bleeding gums, frequent infection, because it supports right up here with your immune support, easily bruising, and also scurvy. Now, oral absorption is reduced with an increased consumption. So as I discussed in the first few slides, I gave the example of high consumption of vitamin C. So we're looking probably more so at that 10-gram mark in one dose can actually result in diarrhea. Now, what's quite interesting is if you take a small amount of vitamin C, so let's say 200 milligrams, you actually absorb more than if you were to take 100 milligrams. So the smaller amount that you take of vitamin C, the more you'll actually absorb and utilize. So generally the idea with vitamin C is to take small amounts throughout the day rather than a large dose of 2,000 milligrams with breakfast. You'll get more out of the vitamin C. Okay, so that was our vitamins. Now we're going to move on to minerals. Now, minerals can be classified into two main groups. You've got your macro minerals and your micro minerals. So your macro minerals such as calcium, magnesium, sodium, potassium are required in much larger amounts. We're talking milligrams, okay? Whereas your micro minerals are actually required in smaller amounts, so milligrams and also micrograms, so a much smaller amount. So let's dive into these. Let's start off with calcium. Now, calcium is required, as we probably all know, for your skeleton support with the production of bones. It's also used in cardiac function. Some of the main sources of calcium are your milk and dairy-based products. However, you can also obtain it from bony fish, legumes, particular nuts, and fortified soy beverages. So a lot of the soy products on the market have actually got added calcium in the product because to support with vegans who don't consume milk-based products, to support with their calcium intake. Now, as we said when we spoke about vitamin D, it supports with the vitamin D supports with the absorption of calcium. Now, if we have low amounts of vitamin D, that can affect the absorption of calcium. If we have caffeine, so if we actually consume coffee with a meal, it will actually reduce the absorption of not only calcium, but zinc and iron as well. So generally, the rule of thumb is to consume coffee about 1 or 2 hours away from food so that you can get optimal absorption of calcium. Particular, as we alluded to in the beginning, diseases within the gut, so celiac disease, because the villi, the villi within the small intestines is compromised, and thereby absorption is reduced. Now, where is calcium stored? Yes, you've got it in your teeth and in your bones. Now, deficiency of calcium can result in osteoporosis. So you can see this image down here. We've got your normal bone here. We've got what your osteoporosis will look like, and then severe osteoporosis. You can see that there's that demineralization within the bones, so a lack of calcium. Okay, more on calcium. Now we've got something called your peak bone mass, and that is the point in time when you've got the highest amount of bone mass. Now what's quite interesting is you actually have peak bone mass in around your early 20s. After that time, your bone mass can only decrease, right? So the amount of bone mass you have at, say, 20, 25, that amount of bone mass needs to support you throughout the rest of your life. That is why, and I'm going to highlight this, this is important, teenagers require much higher amounts of calcium than men and women do, because we are actually trying to build up bone mass within our bones. And then also when you are over the age of 50 for females and 70 for males, it increases as well, because that's when osteoporosis is more likely to develop. So after the age of 20, 25, it's all about maintaining bone mass. Okay, magnesium. Magnesium is an interesting one. It's generally recommended for nervous system support. However, it's got a number of other particular functions within the body. It also supports with bone development, and also supports with glycolysis, that is the production of energy. Okay, it supports with muscle contraction. It supports with the normal rhythm of your heart. It supports with the transport of calcium and potassium ions across the cells. And it's mainly found in green leafy vegetables. Don't we love our green leafy vegetables? Also in legumes, nuts, seeds, unrefined grains. So a lot of plant-based foods here will be your main source of magnesium. Now, deficiency, that's frank deficiency of magnesium is quite rare, because it is found in a variety of different food. However, individuals may require higher amounts of consumption of magnesium. For instance, the consumption of alcohol and coffee will actually increase the excretion of magnesium. Thereby, if you're an individual that relies on coffee and alcohol, or not rely, if you consume a large quantity of alcohol and coffee, then the likelihood of having lower, or let's say subclinical deficiency of magnesium is actually increased. Sodium, so aka salt, right here, sodium chloride. We do need sodium in our diet, although it gets a bad rap, and the vast majority of people actually consume too much sodium. Individuals that don't consume enough sodium have got health issues as well. It's generally proposed that it is a balance between sodium and potassium, and that the consumption of those need to be balanced out. We'll learn about potassium in the next slide. Now, it is high amounts, might I say, increases blood pressure. So if you consume too much salt, in some individuals it can increase blood pressure and thereby increase the risk of cardiovascular disease and kidney-related diseases. Now, the suggested dietary target, remember we covered your SDT, your suggested dietary target in week 1, is 200 milligrams per day. There is no upper limit determined for sodium. However, potentially in future years that may change. Potassium, as I said here, look at this, offsets the effects of sodium on blood pressure. So the two of them really benefit one another, or they go hand in hand. It supports with moving nutrients into cells and waste products out of cells. Now, look at this, mainly found in green leafy vegetables as well. Things like cucumber, zucchini, eggplant, pumpkin, root vegetables. So the consumption of plant-based foods can support with that balancing act of sodium within our diet, whereas sodium is most frequently found in highly processed foods. Low levels of potassium can result in you feeling weak, tired, muscle cramps, and so forth, can actually affect the rhythm of your heart. Iron. Iron is involved in a number of elements, but let's just focus on its role in hemoglobin, which is the transport of oxygen to tissues around the body. Now, there are two types of iron within the environment. You have heme iron and non-heme iron. Heme iron is derived from meat, fish, and poultry. So animal-based products, that's heme iron. Whereas you've got your non-heme iron, that is derived from plant sources, so grains and vegetables. Now, this is a major take-home message. We alluded to this when we spoke about vitamin C. Non-heme iron is needed. Non-heme iron needs vitamin C to enhance absorption. So when you consume non-heme iron, such as spinach, adding vitamin C rich foods such as lime or lemon can actually support with the iron absorption. Okay, deficiency, extreme tiredness, shortness of breath. Why? Because it's the transport of oxygen to tissues throughout the body. Dizziness, lightheadedness, an inability to concentrate, impaired cognitive function, impaired immunity, and a number of adverse events during pregnancy, especially for the fetus. Copper. Although many people have much higher copper in the body than actually required, copper is an important factor for a number of reasons. It supports with building tissue, especially your red blood vessels. Supports with maintaining blood volume, such as red blood cells, and cellular energy on your what we call your electron transport chain. It's generally found in organ meats such as liver, seafood, nuts, whole grains, seeds as well. Deficiency is rare. However, it can result in a number of problems in relation to where copper plays a role in, such as blood vessels, anemia, and skeletal problems. Iodine. So iodine is essential for your thyroid hormone. You've got your thyroid hormone T3 and T4. T3, T4 basically means that there's 4 molecules of iron and 3 molecules, 4 molecules of iodine and 3 molecules of iodine. That's T3, T4, which are the major hormones within your thyroid. Now, your thyroid supports with metabolism. Your thyroid is a gland, an organ right here. Okay, and it supports with normal growth and development. Now, what's quite interesting is iodine content in food, it is quite low. There's only a few foods in the environment that has iodine in it, okay? And if you cook iodine-rich foods, then it will actually reduce the content of iodine. Some of the sources of iodine-rich foods, you'd be thinking of your seafood items and also seaweed. I'll show you this one. This one you can get it at shops. It's seaweed with a little bit of salt on it, and it's a great source of iodine. Now, in 2009, the Australian government introduced a mandatory iodine fortification of salt. So you actually see if you've got table salt or normal salt at home, it will say iodine fortified, and it will actually contain iodine in it, because the government realised as a public health initiative that this was a way that we can actually increase iodine consumption within the environment. Now, if you don't consume enough iodine, it will affect your thyroid, and you can develop this thing called a goiter, which is an enlarged thyroid gland. Zinc. It's mostly found in animal-derived foods such as meats, fish, and poultry. However, it can also be found in nuts and seeds such as pumpkin seeds, sunflower seeds, and almonds. Some of its main functions is it supports with the immune system. Now, from the nutrients we spoke about today, zinc and vitamin C would be the most important for supporting the immune system. Zinc also supports with wound healing, vision, smell. Individuals with low zinc or not enough zinc or a zinc deficiency can actually have an inability to taste and smell. Other deficiency symptoms are impaired growth, suboptimal pregnancy outcome, and look at this, an impaired immune response. Severe deficiency, it is rare. However, if there is a long period of severe zinc deficiency, you can look at sudden hair loss, you can look at diarrhea, delayed sexual development, and so forth. Now, your recommended dietary intake, your RDI for zinc, differs between men and women. Now, if we look at the RDI of iron in women is much higher than in men, whereas with zinc, it's much higher in men than in women. So men require more zinc for the production of semen, whereas women require more iron as they have a menstrual cycle and they lose blood and iron stores every month. Okay, last mineral, fluoride. Okay, fluoride supports with, or let's say assists with teeth development and really prevents decay within our teeth. Now, what I will note is there's two major sources of fluoride in our environment. They are fluoride within our water and fluoride within our toothpaste. What's quite interesting is the benefit of fluoride is the application to our teeth and not necessarily within our system. Therefore, fluoride fortified water only has its benefit for our teeth when it passes our teeth. So it doesn't actually have a benefit when we actually consume it or ingest it. So toothpaste is the preferred source of fluoride to prevent a number of dental cavities. Okay, this concludes session 4 for nutrition and healthy eating. I hope you've enjoyed this session and I will see you all on Monday. All right, happy eating.